Good afternoon. This is Connie Clark with Home Helpers, and it is Saturday, 4 o'clock. It must be time for the senior moment. This afternoon, I have two folks from Hospice of North Idaho. I have Grant, who is on their spiritual care team,
Oh,
and Mary Lennox, who is their director of social services. And one of the subjects, I'm not sure if that's the only subject we're going to talk about here this afternoon, but one of the subjects we're going to talk about is a program that the National Hospice Foundation of America
yes.
had. It's called End of Life Ethics. And, someone would go, End of Life Ethics. Well, what exactly does that mean? Because that's what I said when I saw this. But once it was explained to me, it made a lot of sense, and I was able to really identify with a number of the scenarios that was brought up. So first off, welcome.
Thank
Thanks,
you.
Connie.
Tell Explain what end of life ethics means or is, or what that whole thing. I mean, it's not just the legal documents.
No, I think it's a way of looking at the decisions that need to be made as folks are approaching the end of their life, and they tend to be complicated a little bit by the fact that there is some technology involved, often technology that's unanticipated, and sometimes technology that is a bit of a surprise for them.
And it's not just the person that is in the process of dying that this affects. I mean, this really affects families tremendously.
Absolutely.
Because a lot of times families have to make major decisions they didn't plan on having to make.
Oh, that's so
right.
true. Probably the biggest cause of these ethical dilemmas, if you will, is the fact that families haven't talked about what they want. They haven't made those decisions and been clear about them with each other. And so when someone has an event and we respond to the emergency of the event, you're starting down a path that you may not want to go down.
And I know, as an example, when my mother passed away, there was a point in time that I needed to make a decision as to what to do. And fortunately, myself, my husband, and my two children, we were all on the same page. So when it came to that decision of what we were going to do, we just looked at each other and went, yeah, because we were all thinking the same thing. We didn't verbally want to mention it, but we were all thinking the same thing. But in a lot of families, that's not the case. Everybody is not on the same page. And
No.
when you said technology, a lot of times we don't even know what technology's out there
That's
until we're in a crisis.
And a lot of the technologies are designed to help people get over a crisis and return to a previous state of health. And at the end of your life, you're not quite as interested in returning to a previous state of health. And so some of that technology has been applied in the past, but has not always been appropriate for that particular stage of their lives.
And as an example, I know a lot of people think, well, I just want to die in my sleep. But I truly believe that there is a very small percentage of people that actually do that, because I could count them on my hands, the number of people that I know that has happened to. And I know a lot more than that many people that have passed away.
One, I think what you're speaking about is dying in your sleep without having any long lingering illness
Yeah.
leading up to that.
Unexpectedly
Just
dying
go
in
to
your
bed
sleep.
one night after having a
Exactly.
perfectly normal day and don't wake up. Yeah, that doesn't happen very often.
That does not happen very often. And so then you run into these complicated situations.
Yeah.
As an example, my sister-in-law and brother-in-law are going through this, where her mother is in the process of dying. And her sister wants desperately to anything and everything possible to keep the mother alive. And my sister-in-law really doesn't want that. And so now you have all this conflict going on in the family.
Yeah.
And the poor mom is at the center of it.
Yeah.
And if the mom's not making her decisions, or she's basing her decisions on what her daughter needs, she's not making decisions that are necessarily going to lead to a peaceful death.
And I know you all had a program on not too long ago that talked about this. And there was a number of examples that were given. Can you give some of the examples of some of the situations? I mean, that one seems kind of common. among at least people that I talked to. But some of the ones that I heard that were brought up were just, oh my gosh, really crazy. And there was the young lady in Florida, I think that a lot of people think of, that was kept alive for.
Yeah, there are a number of national examples over the course of the last couple of decades, actually many decades, that have encouraged us to talk, to avoid those things. But there are, and the examples that were given during the presentation did mention the well-known national ones, the Karen Ann Quinlan and Terry Schiavo situations where those folks were fairly young and so would not necessarily have ever discussed how they wanted to be treated at the end of their life.
Point. Good
but
point.
suddenly found themselves at the end of their life, not that they were necessarily aware of it because of the state of their brains, but their families were suddenly struggling with, what do we do now? What would they have wanted based on how they lived prior to this event?
And that seems to be a conversation people should have even before they're a senior.
Long before.
There was some conversation, I think, and I can't remember now whether it was at the local panel or someplace in that presentation, they were talking about how young should you begin to talk with your kids about what they might be interested in for themselves, which was an interesting conversation that I had never thought of before. But
That's a good point. Well,
Yeah.
what did they say? How young, or what's the appropriate age?
well, there were a couple of different ages mentioned. One was 12, I think.
Yes, I think there was some research out of the Children's Hospital in Seattle that our medical director, Robert Anker, mentioned that 12 is an age appropriate for having such a conversation. That logic and rationality have sort of settled in the brain maybe a little bit, not wanting to tread on his territory at all, but that a 12-year-old is capable, not all, of course, but some 12-year-olds are capable of such a conversation.
Boy, that would be an interesting conversation to have. And it'd be
would.
scary. I mean, but those things happen.
Yeah, and the cultural notion of death tends to be a scary one at the moment. I don't think it necessarily has to be, but in the way our culture sort of has arranged itself with regards to death, it does have sort of a pall over it, and so it could be a scary one. They talked about teachable moments when the chipmunk dies.
Exactly.
That might be helpful in terms of approaching the
The
subject.
family pet, yeah.
Yeah.
Or grandmother, for
Or
that
grandmother, yeah.
Oh, that's interesting. Okay. Yeah.
Talking
Well-
about death always is for us.
Yeah. Well, yeah, okay. So what kind of advice did they give, or did they? I mean, when you run into that situation where all of a sudden somebody has to talk about making a decision, what do you do?
Well, if you're talking about end of life care for a loved one, obviously there's a lot of emotion involved, and so to try and wrap your arms around the concept that everyone is going to face this at some point in their lives, and that I encourage people to think about it now, to maybe even imagine their death and their perfect death, so they become more comfortable with the thought of their own death. It's much easier, I think, personally, to get my arms around the thought of my own death than it is my loved one's death. But
That's a good point. That's a good point.
but to be aware that everyone dies, and that I don't think it does anyone any good to be hysterical when this is coming. Now, of course, we're talking about an expected death. There are all sorts of deaths that there's no way to prepare for. A tragic, sudden death. Hysterics seem perfectly appropriate under those circumstances, just because of the nature of that sort of death. But we're talking more on the lines of someone who's lived and is planning for their own death and is able to communicate and is more at peace with it. That's the ideal, and of course, not everyone gets to live that ideal.
I think another piece too is to not have it be just one conversation. To have the conversation be extended over several different occasions. I had a couple of friends in the congregation I served where they had talked about their wishes if either one of them were unable to communicate how they wanted to be treated, and they were convinced that they didn't, neither one of them wanted any kind of heroic measures to extend their lives. And yet when the doctor told the spouse, the wife, that she needed a stint to help her survive her cardiac situation, the husband began with the speech that they'd worked on together, and she says, "No, I don't think this is the time for that."
No, we're not there yet.
Right,
Oh,
minor
yeah.
surgery versus major
Yeah.
invasive
Yeah,
procedure.
you got to kind of put like a
Some perspective.
a
in it,
line
yes.
in
Yeah.
the stand or something like that. Well, and death is a scary subject. I mean, my husband and I had this conversation the other night talking about what we wanted to do so far as buried or whatever. And I said, well, there's the rational part of my brain that says, I am no longer alive, so I want my body donated to science. I want to be cremated. That's the rational part.
Yeah.
But the emotional part goes, oh, I don't know if I want a bunch of people poking at my body, and I don't know if I want to have my body burned,
Well, we are pretty attached to them.
Yes, but it's two different, I guess, sides of my brain battling with each other, the emotional part and the rational part, and neither one of them have decided to back down yet. So,
It does take us a while to get comfortable with
yeah,
those
so
thoughts,
I'm not
truly.
really sure at this point, but it's a weird discussion to have in your head.
And I think that's why Grant's point is well taken, that to really have these conversations occasionally, certainly not to necessarily dwell on them, but there are appropriate moments where revisiting the topic is beneficial, just to get your own arms around it, let alone your loved ones.
And it is hard. Like I said, I had to go through this with my mom. And if they were to keep her alive, she'd have to be on a respirator. She wouldn't be able to walk anymore. And I thought, my mother would just be so upset with me if I did that to her.
Connie, you just indicated what hospice is really all about, is trying to maintain the quality of one's life while one is still living.
Mhm.
And some folks choose quality over quantity. Just spoke with someone recently who chose to forego treatment, knowing that she cannot be cured, but doesn't want to be going to the doctor 3 times a week in the last weeks of her life. She wants to be at home with her family and in a setting that's comfortable and beautiful, and that's her choice. She's choosing quality in her mind, and no one can determine what quality of life is for another person. But you knew, based on your mother's,
Oh, she would be mad at me.
yeah,
If I did that to her, I know she would.
that would not be quality.
No,
Yeah.
she would not be happy. But then you get the emotional part going on, especially between siblings not wanting to let go of that person. And it's not the decision that they're making for their loved one, it's a decision they're making for their own emotions.
And an area of complication in that scenario that you describe is the notion that it's possible to assign a particular surrogate as that has decision-making ability, so that one brother or sister gets to be preeminent among the conversation among the siblings as to what's going to happen to mom.
Well, and it doesn't even have to be a family member.
That's true.
You want
Yeah.
to choose someone that you know who's going to honor your wishes. If your wishes really take precedent over your loved ones, some people would choose all their family members and try and guide them through that, but wanting to honor their needs. So may be willing to endure a bit more just to make sure everybody has a chance to come to terms with what's happening.
Yeah.
So.
Yeah, because I know for a fact that's a really difficult decision, and especially when there's multiple. I was lucky. We were all on the same page, but I have seen so many times in families when there's multiple people, there's almost always one person who goes, no, I don't want them to discontinue treatment
Mhm,
or
mhm.
them to take her off life support, she's going to make it,
Yeah.
and
Out of guilt or
yeah.
fear or any number of other things.
Sometimes a particular sibling hasn't seen the suffering that the parent has gone through.
Yep.
That's a good
Indeed.
And
point.
comes
Yeah.
in from out of town and says, "Oh no, this is a piece of cake. We'll just give her another couple of months
And she'll be fine.
and she'll be fine."
Right. Right.
It is a very, very difficult situation.
It's
and
complicated.
and I know you all deal with it all the time. Um, Again, what do you do? I mean, how do you talk to a family member who is just so focused on keeping mom alive at whatever cost? How do you talk to that person?
I think the first place that seems appropriate to me is to give them the medical situation as clearly as possible and the alternatives and the consequences of choices that they make so that they have a little bit of a background.
So
as
there's
to-
the logic,
there's the
logic
logical
side
piece.
going. Okay.
Yeah, and then to connect it with some of the family dynamics and how are you all getting along with this conversation? How are you coming in your choices? And let them explore a little bit about what that feels like to them.
Sometimes we struggle because families come to us and they are not happy with each other, shall I say? And
Oh, I've seen that. Yes.
there's no way to fix that. We're talking decades of history.
Oh, the history comes up all the
Sure.
time. Yeah.
So the best we can do is ask clarifying questions, find out what interest each person has, what's at stake, what's the most important aspect of the situation, and really try and get to the heart of the situation and try gently to encourage everyone to participate and come to the table and work on a mutually agreeable plan.
Something I might mention too is that one of the frustrations that we have is when we become involved in a case late in the day, as it were.
They
So we
haven't
don't
brought
have as
in
much time.
hospice early on.
Yeah.
It's, you're down to the wire here, so to
Exactly.
speak now.
Yeah.
Okay.
The more time we have, the more opportunity there is for exploring those kinds of relationships and dynamics that families have.
Yeah, because I would think you can bring in hospice 6 months prior to what's determined for the terminal illness. Is that correct?
Yes, a physician will state that if the person's disease follows a normal course, they can be referred to hospice once they get to the point where it looks like they have 6 months or less. I always make sure that folks know when they're being admitted to hospice, they are not required to die in that 6 months. Because some people actually, I think, have that then as oh my gosh, 6 months,
That's
months,
all I've
6 months,
got.
and they just obsess on the 6 months. And we really want people to live. And if they're going to live longer than 6 months, they're going to live longer than 6 months. But sadly, we get involved way too late, far too often.
Yes, I talk to a lot of people who are at that point where it's just a short period of time. And when I bring it up, well, they're not dying this week. Well, no. But, this can be brought in prior to the last week of life, and it really should because there's a lot of work that has to be done before that.
Yeah, indeed.
I want to continue this conversation, but we need to take a break,
Okay.
and so we will be right back.
That was 18 minutes?
It goes by really quick.
Indeed.
I talk to people, they go, I can't talk for that long. And then we're going, wow, we're done.
I wasn't worried about that, but
We're done.
still flew by. Granted, I can talk.
Hey, I love it. I love it when I have people on that can talk because it's really hard when you have somebody who doesn't.
Oh, I bet.
And you can
Painful.
pulling
Yeah.
stuff out.
Yeah.
Okay. Tell me what kind of other direction you want me to go in this.
Hmm.
For me, I would love for there to be less fear associated
Okay.
with death. And
Okay.
and as a former clergyman, I find that faith backgrounds have been helpful for me in relating to people around their notion
Okay.
of death and dying. hobby horses, that for a Christian nation, we have a lot of fear about
We
that.
do a lot of things weird for being a Christian
Yeah.
nation. Okay, then we'll go down that path. Okay, so we'll do another 18 minutes. Okay.
Sure.
And we're back. Again, this is Connie Clark with Home Helpers. And this afternoon, I have two very knowledgeable folks here from Hospice of North Idaho, Grant, who is part of their spiritual care team, and Mary Lennox, who is their Director of Social Services. And we've been talking about the ethics piece of dying and some of the things that happen to family dynamics and decision making and that sort of thing. And I had shared with you all the struggle that goes on in my brain, my logical side and my emotional side. And I think the emotional side really doesn't want anyone messing with my body, because it's like, well, maybe I can come back. And I'm so afraid of being gone, I guess. And that's something, Grant, that you had brought up in the break here, that people are afraid of dying, and I will admit I'm one of those people. So why is that? I mean, it's, you know?
I'm not terribly sure. There was an old gospel song, "Everybody wants to go to heaven, but nobody wants to die." And
Oh, I like that. Yeah, absolutely.
and Woody Allen used to say, "Death doesn't bother me. I just don't want to be there when it happens." I think part of it is the experience, maybe, of suffering that people recoil from,
Or the pain they associate with
Yeah.
it. Okay.
And hospice is so wonderful at addressing that particular piece, that I think we could really set those particular fears to rest, just by virtue of the resources that we can offer people. Very often we're able to give people a really comfortable death. But I think that somewhere along the line we got to think, and maybe it has to do with the practice of medicine and the notion that if somebody dies, it's like a failure.
Oh, that's a good point. You know, because we've done all of these researches and everything, and we've figured out all these ways of fixing things and curing things. And so I like that. Makes a good point that if someone dies, we failed to cure them or to fix them or whatever.
Yeah.
So that's a good point.
And so longevity then connects with success and well-being, when in fact a lot of the folk that we see really suffer tremendously in the process of extending their lives.
And because I know when you're on hospice, your main focus is for the person not to be in pain.
Yeah.
So if you've prolonged the fact of, I'm not going to put this person or myself go in hospice, you've prolonged your pain.
Yeah, I've often thought that when it is my time and someone mentions hospice, in fact, I'll probably be the one that brings it up, because the work I have seen done at hospice, we don't replace the family by any means, but we are a resource for information, access to comfort care. Lots of folks are not able to have really intimate conversations about, say, their spirituality or the kind of person they've been and the kind of life they've led with family. So we have a great honor occasionally, because some folks just never get there to have this sort of conversation. We have a great honor of having those kind of conversations at the bedside, helping folks kind of make sense of their lives. I remember one gentleman I served a number of years ago who absolutely teared up and said, "No one has ever talked to me like this. No one has ever asked me questions like this." And he wasn't a particularly religious man, but he'd certainly had some things he wanted to get off his chest, and was able to do so in that conversation. That was an incredible honor for me, to be there with him as he was making sense of his life and the choices he'd made. So those sorts of conversations can be incredibly healing, and I think help people work through the fear of dying. I also like to ask folks, are they afraid of the process of dying or of being dead? Two very different things. Most folks are far more comfortable with the idea of being dead than they are of going through that process.
And maybe the fear of what happens after that.
Possibly, possibly, and certainly it's a great opportunity to talk about why they're fearful of that and what we can do to heal that fear.
I know my aunt, she had done a number of things in her life that I really would not do myself. And when it came time, she was really terrified of dying.
Yes.
And I know why she was terrified, because she was very afraid of afterwards. And her minister came in and talked with her, and the next day she passed away. But I know she was just terrified because of what she felt was after,
Yeah.
you know.
So I'm sure you don't know what was said during that
No,
conversation
I don't.
with her minister, but
No, I
somehow
don't.
she found a level of peace. And I think sometimes people get so fearful of being judged by other people, by their pastor,
By themselves.
by themselves,
Yeah.
that they forget that there's room for forgiveness in this world. Um, and Grant, you can certainly speak more to that than I.
Well, it's ends up being a wonderfully healing kind of an opportunity for people when they're able to come to the realization that there's no more that they can do to earn or to make it right for themselves, and so they just have to accept the notion that God's going to be a forgiving, loving presence in their lives and in their death and in their afterlife as well. I think a lot of people tend to like to be self-sufficient or consider themselves up by the bootstraps sort of people.
I don't need anybody kind of
Don't
thing.
need anybody. I can
Yeah.
fix whatever challenges or whatever's broken in my life. I can fix it. And at the end of life, there's often a realization that I can't do it anymore, and that becomes a wonderful opportunity for a whole new paradigm of life, whether it's within a particular faith tradition or a general philosophical idea.
Well, you bring up the idea that I like to encourage my friends who are middle-aged that they practice accepting help now, even in just small little ways.
I was just going to say, wouldn't it be nice if we could do that before we're about to
Sure
die?
would.
You know?
Yep.
Connie, I'm forced to, especially during the winter months, because I don't see in the dark anymore, and it's not safe for me to drive. So I rely on the kindness of many of my coworkers and my spouse to make sure I get where I need to be during the winter months. So I'm extremely grateful to my friends and coworkers, but I'm also grateful for the opportunity to sort of make peace with having to ask for help. It's not easy, but boy, there's a lot of freedom once you get yourself in the mode that we are all interdependent. No one can live solely on their own, and certainly when it comes to dying, why not have a team of folks who've walked with other people, who know a bit more about death than most folks do, and are far more comfortable with it to support you.
That's a good point that you said, comfortable, because prior to me, I guess my parents passing, I had never really experienced a lot of people close to me who had died. I mean, there were relatives far away, but nobody
Sure,
close. And since my parents have passed away, there has been so many people in my life, both personally and professionally, that have passed away. And in the beginning, it really wasn't comfortable. I really didn't want to talk about it. I didn't want to see it. Didn't want to know anything about it. But it seems to be something that's more comfortable, which I don't know if that's a good thing or not, but more comfortable with
think
me
it
now
is.
because
I think it is.
I've been around it so much more.
Yes.
I think that again speaks to the fear in the culture is that we've tended to compartmentalize death and dying and separate it away so that
Yeah. And
it's out of sight and
institutionalized
out
it,
of mind.
too.
Yeah.
Yeah.
And more conversation about it would definitely lessen that fear and more experience with it as you experienced in your own life. And so I'm a great proponent, for example, of bringing grandkids to grandma's funeral. And
Or to grandma's bedside.
or grandma's bedside, and having some sort of ritual or prayer as she dies.
Because they really do remember that.
Yes.
My children really remember that,
Yes.
and I know their children do.
And it normalizes death.
Well, is that a good thing that death is normalized for us?
It's a normal part of living.
Okay,
It's as normal as giving birth.
that's true. All
And we
right.
celebrate giving birth, bringing new life into the world, and I think we need to learn to celebrate death and seeing people out in as jubilant a way as possible. It's another transition. They're accomplishing something that I have not yet accomplished, and not that I'm looking forward to dying anytime soon, but I know it's coming, so why not be prepared for it?
And it wasn't a failure.
It wasn't a
Exactly.
failure.
Yeah.
No.
Very interesting. I didn't expect to have these aha moments in here this afternoon. But you make really valid, interesting points.
It's wonderful to be able to talk about them with you.
Yes.
We talk about them a lot between ourselves, but I'm grateful for this opportunity.
Well, and I remember the one death that really jumps out at me is when my father passed away, because my mother seriously thought that hospice killed him.
Oh. Yeah,
Because
it
if
happens,
if
yeah.
they had not brought hospice in, he would have made it, and he wouldn't have.
You know what I say to that is that most hospices or hospice workers have really big shoulders. We know that some people are going to be angry at us because we were involved, whether we did absolutely perfect care or not. Anger is far easier to deal with than sadness. You know, if you're sad, you're crushed, you're crying, you're maybe you think of yourself as weak. But if you're angry, you're full of action and power. So we
And you
get
can tell everybody you're angry, and it's
Exactly,
okay.
and we get that sometimes, and we do our very best to just encourage that person to talk about it. We have a wonderful bereavement staff that follow the survivors of one of our patients for 13 months, longer if necessary. Sometimes they don't even get started until 13 months after the death, but they help folks really make sense of it. I had a dear friend in Minneapolis who thought she'd killed her mother by administering the pain medication. She was the only one brave enough to do it, and we sat on her couch at 2 o'clock in the morning talking about her mother's death, and she just bawled at the thought that she'd caused her mother's death. Her mother's cancer caused her mother's death. She did nothing to hasten her mom's death. It simply was time.
And it's, like you said, more peaceful.
Yes.
Very interesting. Yeah, because it is easier to. I mean, she told everybody, because that was an easier conversation for her
Sure.
to
Yeah.
have.
Yeah.
That's right.
Her anger
Oh, yeah.
conversation versus showing emotion and being sad. That conversation.
Oh, we're very vulnerable when we're sad.
Okay, that makes sense. And I'm sure other families go through that same thing.
Absolutely. Families have an almost unlimited number of ways of reacting to crises, and this is probably one of the major crises for most of them. And so we find families that won't call us until the last minute, or they'll call us and they'll say, "Please don't say that you're from hospice if you come," or they'll call us and say, "We want you to come, but only when we say," or they'll say, "We want you to take care of mom, and we don't want to see her again, or we don't want to see her until the very last."
Yeah,
Or
we hear all kinds of things.
there's any number of ways that families would like to incorporate us into the way that they typically handle things, and so it's both a privilege and a little bit of a tightrope that we sometimes walk when we walk with
I'm sure it's very much
clients.
a challenge,
Yeah.
and you really don't know what you're walking into.
That's true. That's exactly right. And that's part of what I love about it as well.
Well, and every situation, every family they have different needs, and we try to honor those needs and make sense with them why they have those needs, and just do the very best care we can based on their goals. It's not one size fits all. It's if pain is the major impetus for having hospice in place, and the person doesn't care about being alert and just wants to be comfortable, okay, but then the family member wants to be able to talk to them, so that means being more alert.
That's
So
right.
it's a balancing act between us and them, the patient and the family. I mean, there's just all kinds of dynamics, and it's fascinating and challenging and really rewarding, really rewarding.
Very interesting. Well, I want to continue this conversation, but we need to take a break. So we will be right back. Okay, now what direction?
Mary gets to choose the next one, I think.
Touched on the fear. Wow. Do you feel like we really talked enough about the fear? Are there things we could maybe touch on that would help people sort of start thinking about not being so fearful about death?
We could. There's a book that came out a couple 5 years ago, encouraging conversations about one's wishes at end of life,
Okay.
and a what do you call it? You could maybe speak to the post.
The post. Oh, sure. We could talk
Okay.
a little bit about the post and 5 wishes.
Some of those legal documents, because a lot of times I think when they bring you all in, they don't have any of that stuff in place.
That's true. That's very true. Yeah.
And so, because that's what I thought when it was the ethics of dying. My my pea brain thought, oh, the legal documents, making
Right.
sure all the right things were in place.
Yeah.
It wasn't the emotional piece. Because when Joe came back and told me, I went, oh, that's not where I thought that was going. Okay. Um, so we
Right.
can.
Well, there certainly is that legal piece, but really, that's really minor compared to people's emotions.
Okay.
So yeah, what to have in place? More the mechanics, the legalities, the things that might help. I haven't spent a lot of time with this book, but a friend she's 85, and she is having all of her friends read a book called Mom, Dad, Can We Talk? So encouraging conversations and how to sort of approach them.
Okay.
And not only about death, but about, gosh, can you really, she's losing her sight too, and can she stay in her home? So those sorts of conversations, at what point is it not safe, not reasonable for a person to
Well, those sound like conversations I have all the time.
Giving up the keys to the car.
Right.
Yeah, oh gosh,
Yeah.
yes. Oh gosh,
Yeah.
yes. Yeah, that's a big conversation.
Yep.
Mm-hmm. Okay.
Exactly.
All right. You want this then?
Sure, thanks.
Okay, then we're back.
Sure.
Okay. And we're back. Welcome back. This is Connie Clark with Home Helpers. And I've been talking with two very enlightening folks that have had lots of aha moments for me here this afternoon. Grant, who is with their spiritual care team, and Mary Lennox, who is their director of social services. This is Hospice of North Idaho. And the subject we had started talking about was end of life ethics, which, when I had first heard this mentioned about a month or so ago, my little brain went to the legal side, thinking about all the legal documents and that sort of thing. But everything we've been talking about so far is the emotional piece of dying and our fear of dying and thinking if we died, then we failed because the medical community couldn't keep us alive for 500 years or whatever
Yeah.
we think we should stay alive for. And so that's one of the things, Grant, that you deal with a lot is the people's fear
That's right.
of dying. And I think it's not just the fear of what happens after I die, but the fear of what happens to the people that I leave.
Exactly. Often there's folks who will want to wait before passing on until the prodigal son returns home, or until the 50th anniversary has been reached, or until some kind of reconciliation has been achieved in a family, and it's remarkable to me how people can postpone their
Summons up
their
all the
death.
strength. My dad
Exactly.
did that.
Uh-huh.
When my dad was in the hospital, they didn't have a hospice house.
Mhm.
And we went and would visit him, and he was just a body. That was it. He wouldn't respond to any communication or anything.
Yeah.
And we went in and told him that my son, his submarine had just pulled into port and called and said he was safe. And my father turned his head towards me, which that's the only movement he'd ever made
Oh.
in the last 3 days.
Yeah.
And the next day, my dad passed away.
Yeah.
So I see that happening a lot with different folks where they're waiting, like you said, for something.
Absolutely.
Yeah. Part of our job sometimes is to help the family figure out what it is the person is waiting for. Could be any number of things. And so if someone's lingering, we'll start asking questions. Who do they need to see? Who do they need to talk to?
What do they need to hear?
What do they need to hear?
they need to hear?
Absolutely. Yeah. Yeah.
And there are times when there's just a plain old mystery about it. When it
Truly
seems like
does.
everybody's there, everything that needs to be said has been said. It feels like it's a perfect time to go, but they don't seem to be going
Well,
anywhere.
There's a lot of internal work that needs to go on
Yeah.
sometimes.
Well, maybe they're waiting for a certain football game or something. I don't know. I mean, it could be something as simple as,
their favorite team. Yeah.
Yeah.
Who knows?
Could be.
Yeah.
Yeah.
and like you said, sometimes it's a mystery, so you really don't know.
That's right.
And sometimes mysteries can be scary too, because we like to have the answers, we like to have the facts, we like to have a certain amount of certainty.
Yeah,
And so
we're not so
people-
good at ambiguity.
No, we
Yeah.
aren't. People will say, "Why I'm ready to be gone, and why am I not gone?" And I'll say, "Well, maybe there's something for you to learn still, or maybe there's something for you to teach."
And like I said, it's not only the fear of what happens afterwards, but what happens to my family after I die. And when you bring in hospice, there's some things that you all talk about, certain documents and certain things you need to put in place, because people are afraid, if I die, I don't have a will, or what happens to my house, or my kids are going to fight over this.
Right. So being prepared is a great way to help families cope with a huge loss, losing a loved one, but then having some guidelines which to follow after the death, even, or as to how to approach the care. So you mentioned the end of life ethics, and your thought was it's the legal side.
I
of
went
it.
to the legal side.
Exactly.
Yeah.
But here's the cool thing about this. If you get those documents in place and you have those conversations, you're far less likely to become one of those ethical dilemmas that goes on the national night's news. No one wants that situation. So to really prepare, whether it's a durable power of attorney for health care or a healthcare proxy is another, someone who can speak for you if you're not able to speak for yourself and make your own care decisions. A living will stating, whether you want this level of intervention or no intervention, being just comfort care, no curative interventions, just comfort care.
And that's when hospice is brought in, that's one of the conversations you all have,
Absolutely.
correct?
I mean, it's great if those things are in place, but often they're not, because again, we're sort of a death-denying society, so folks often don't have those things in place. So we encourage folks to make sure that those are done. We'll sometimes go to health fairs and events and hand those documents out. It doesn't require a notary here in Idaho. It's a fairly straightforward document to fill out. And then you're a step closer to being ready for those conversations and ready for approaching the end of your life.
So if someone has gotten a terminal diagnosis, it would then be appropriate to say, okay, family, let's pull out my living will and let's talk about what we want to do. I mean, yeah, we'll have that conversation. You think I can be cured, and what do I need to do to be cured? But if not, let's talk about. And that's a hard conversation to have,
Yes.
because
but
then
I
you're
think-
admitting you really are terminal.
But I think it's harder to not have it, and have the family dynamic sort of bubble up around you.
Explode, yeah.
Yeah. For me personally, I am much more comfortable having frank conversations than just hoping it works out okay. I want folks to know what my wishes are. It's important that the people around me are kind to each other, that the environment that I am dying in, living in until I die, is peaceful and loving. And if my siblings are fighting over, the artwork in the house,
Yeah, I was just
I'm not
thinking
gonna
that
be
all the stuff in the
comfortable. I'm not
garage
gonna
or,
be
you know.
peaceful. So, really try to attend to those sorts of things and plan. I mean, you plan for a wedding, you plan for a vacation, you plan for retirement. Why not plan for your death?
And it makes a lot of sense to talk about it within the context of how you want to spend your life. What are your goals for this part of your life?
Yes.
Is there somebody that you want to see? Do you want to visit? Do you want them to come to you? We had a lady who had grown up in this area, and it came out that it would be really helpful and important to her to be able to go up in an airplane and see that place, because she was connected, she was rooted to the land that
Yeah.
she had lived on for so long. And so that became part of her finishing up her affairs, putting her affairs in order to be able to have that experience, as well as to signal how she wanted herself to be treated in the end of life.
And
That's
the-
interesting.
The pilots still talk about that adventure. We helped make those arrangements, and they just were amazed that this elderly woman had the desire to do this, and they were so proud to be a part of helping her accomplish one of her wishes, her bucket list, so to speak.
Yeah.
Yeah.
Yeah, that was a really great movie because a lot of people now use that term bucket list.
Absolutely.
Yes.
You know,
Thank
and-
you, Jack Nicholson.
yeah,
And Morgan
and so
Freeman.
and that's instead of I've always wanted to do this or I've always wanted to do that. If you just say bucket list, everybody knows what you're talking about.
Exactly. Don't wait. Really plan on tackling something this year on your bucket list, because you just never know.
No, you don't.
Yeah.
No, you don't. I've known too many people that it has come quicker than they thought, and
Exactly.
you really don't know. And still, and even in thinking of someone like that, we just recently had someone die very tragically, and I know she would just be terrified to think of what happened to her family after she was gone. You know, and you're afraid because you've been caring for these people or taking care of them, and now they don't have you to do that.
And sometimes the families need to grow as part of the process, and to be able to convince the one who's leaving that they're going to be okay. So there's personal growth, I think, on multiple fronts at the time when somebody's facing death. And families very often do step up to the plate when the time comes. That's something I enjoy being able to witness as well.
We're often stronger than we realize.
That's right.
So a friend of mine who lives in the Midwest, and she's now 85, she just introduced me to a book. I haven't read it yet, but she has all her friends reading it. It's called Mom, Dad, Can We Talk? And I think it might be a great starting point to help families have conversations, care conversations, not even necessarily in preparation for death, but how long do you live in your home and try to maintain that home? When do you start looking at maybe assisted living facility or a certified family home? When do you look at maybe moving in with relatives? Those conversations often also don't happen. And then all of a sudden
no.
something happens and it's urgent. We got to move Mom in because she fell and
Yeah.
whatever, So to start thinking about the changes that life brings and preparing for those.
That is a major conversation that we see not happening a lot of times when we talk to folks.
In your industry,
Absolutely.
absolutely.
Because now, usually, like you, their families are in a crisis mode.
Right.
And so, oh my gosh, what do we do? What do we do? What do we do?
Mm-hmm.
You know,
And do you make good decisions when you're
No.
in crisis mode?
absolutely not.
Typically not. Yeah.
And lots of times there's old messages that were didn't have that much to do with reality. Like, Mom made us promise that we'd never park her in a
Oh, yes,
a warehouse kind
absolutely.
of a thing.
Yeah, that's a thank you.
Absolutely.
That need to be revisited.
Yeah.
Well, we're coming towards the end here, so let me kind of wrap this up. Now, if tell me again the right words to bring hospice in.
Wow.
Now, well, you
well-
said within 6 months.
Yes. Oh, yeah, yeah. If a physician feels that if the disease is following the normal course,
And that's important, normal course.
yes, because everyone's individual.
Right, okay.
If the physician's able to predict, and that's always tricky also, that the patient has 6 months or less to live to get hospice in place. And hospice can be a wonderful support in so many ways that, and our care is, in my opinion, so good that folks often live longer because their pain is better controlled. They have access to the resources that will make them more comfortable and increase the quality of their life. So then they want to live longer.
And so it's nothing to be feared.
No.
Hospice, like my mother thought, doesn't come in and shorten the life.
We should maybe mention our palliative care program as well, because when you enroll in hospice, part of what you're saying is that you're not going to
Seek curative measures.
Thank you.
Yeah, yeah.
That's the phrase I was looking for. You can do that with our palliative care program. You can continue to get chemotherapy, for example, and still become known to us, so that you're maybe being monitored on a monthly basis by our
And
our
you
nurse
could get the
practitioner.
spiritual counseling and the
Absolutely.
legal help and all that sort of
Yes.
thing.
Yeah.
Perfect. Well, thank you very much for coming in this afternoon and talking about a very difficult and emotional subject. I really do appreciate
Oh, it was an
you
honor,
being
Connie.
here.
Thank you.
Thank you, Connie.
One of the things I do want to bring up is on Saturday, December 1st, over at the McGrain Center at Kootenai Medical Center. They are participating in the Arthritis Foundation's Jingle in the Water for Arthritis. So if you can't run like me, to be in the running portion of the fundraiser, you can go play in the pool and be part of the fundraiser. It's $15. They have a 92-degree therapeutic pool, which sounds really nice right now. And you can goof around, bring your kids, bring your seniors, and have a really good time. It's $15 and help support the Arthritis Foundation. So keep that in mind. And again, thank you, Grant and Mary, for being here and talking about this very sensitive subject.
It's a pleasure.
Again, this has been Connie Clark, and you've been listening to The Senior Moment. You all have a wonderful rest of your weekend.